Hello, everyone. I want to welcome you to our webinar today. Today's Mips tip session is on what you need to know about the 2021 performance year. I am Miranda Brzezinski, a technical assistant support contractor with Mountain Pacific, and I want to thank you for spending time with us today. The Mips Tips webinar are a collaborative effort between three organizations, named on the slide you see, with the goal of providing clinics, clinicians, and support staff timely information on the quality payment program and to give you a chance to ask your questions related to this program. Between Comagine Health and Mountain Pacific, we support practices in a variety of states. A few housekeeping items before we get started. Please take a moment to locate the chat feature in this webinar platform. Links to the resources that the presenter will share on the screen are posted there throughout the webinar. This webinar is being recorded. The resource links shared through the chat, a link to the recorded webinar, and a copy of the slides will be shared with the attendees and registrants in an email following the webinar. If you would like to download a copy of the slides so you can follow along with today's session and take notes, I will put a link to in the chat where they can be located. The slide deck and recording will also be available on the Comagine and Mountain Pacific websites following this event. You can find slide decks and recordings from our prior webinars, along with a lot of valuable QPP resources there as well. So please visit those websites. We have very experienced presenters today that will be going through a lot of information, and we want to make sure to answer your questions. You will remain unmuted throughout the webinar, but you can use the chat feature to interact with our team and the presenters. Please feel free to share your thoughts, comments, and questions with the entire audience. Members of our team will be monitoring the chat and will bring your questions forward to our presenters during the moderated question and answer that will end today's session. Your feedback is very important to us. When you leave the webinar today, we ask that you provide your feedback on how we did on the topics of interest to you for the future webinar, and on topics of interest to you for future webinars. Watch for the evaluation survey link and please take a moment to fill it out. Thank you. So today we'd like to start off with a quick poll question. We are very interested in knowing who our audience is. Your options will be clinician from a small practice, that is 15 or fewer NPIs, clinicians from a large practice, that is 16 or more NPIs associated with a TIN, clinical staff from a small practice, clinical staff from a large practice, or other. And if you mark other, can you please place your role in the chat box for us? So go ahead and answer the poll. We'll give you a couple more seconds here. Looks like we're having a lot more support staff than actual clinicians. That's a good thing to see. Okay, looks like it has slowed down. So London, do you want to end that poll? All right, looks like our winner today is support staff from small practices. All right. So today we're going to be covering an overview of Mips 2021, specifically covering the changes that occur from 2020 to the 2021 program year. We will also address ways to get a neutral score in the 2021 so you don't receive the negative penalty and that can be avoided. We will briefly go over Mips value pathways, which have been pushed back to 2022 by CMS. They were slated to start in 2021, but again, those have been pushed back to 2022. We will discuss COVID impacts to the Mips program for 2020 and what we know so far for the impacts on 2021. And finally, we will go over a plan for what you need to consider in your practice for successfully participating in Mips for 2021. Before we start today's webinar, I want to go over a few retroactive changes that were made to Mips performance year for 2020. The complex patient bonus was increased from a maximum of 5 points to a maximum of 10 points. This change only affects the 2020 program year. The extreme and uncontrollable hardship application deadline has been extended from December 31st, 2020 to February 1st, 2021. And it's important to note that this extension is valid only for COVID-19. The other EUC selection options were not extended. And as a side note, it is important also to note that APMs can submit an EUC application for the entity. It would just be submitted through their individual TIN, and you can, and you would have to be clear that COVID directly impacted the APM and make sure that is noted for the Mips categories that you select. And finally, the caps for accountable care organizations for Medicare Shared Saving Programs, ACO, was waived for 2020 only. All right, now that we're through with all that, let's start with our Mips 2021 overview. So there have not been any changes to the participation options for 2021. You can still report at the individual level, the group level, or as part of a virtual group. You will still be able to opt into Mips 2021 if you meet at least one of the low volume threshold requirements. As an opt-in participant, you will be subject to the positive as well as the negative adjustment dependent upon your score. If you are below all 3 of the LVT requirements, you can volunteer report. And in this case, there will be no payment adjustment, positive or negative. To refresh on the low volume threshold, it is made up of 3 requirements. You must bill more, the clinician must bill more than $90,000 a year in allowable charges for covered professional services under the Medicare physician fee schedule. And he must furnish, and you must furnish covered professional services to more than 200 Medicare Part B beneficiaries and provide more than 200 covered professional services under the PFS. So in order to avoid the negative payment adjustment for up to 9% in 2023, so remember that even though it's participant year 2021, the payment adjustment is effective in the future for 2023, you'll have to reach 60 points in 2021. And that's up from 45 points in 2020. This year, the quality category will be 40% of your total MIP score. That's down 5% from 2020. The cost category is 20% of your score and is up 5% from 2020. The PI and the improvement activities categories have stayed the same, with PI being at 25% and improvement activities being at 15%. All right, let's talk about the changes to the quality category for 2021. There are 113 existing MIPS quality measures that have been changed. This means that if you are reporting the same measures from 2020 in 2021, it is important that you look at the measure specification guides for 2021. You want to be aware if there have been changes to your selected measure and adapt your current modes of tracking them accordingly, and also be in contact with your EHR to confirm that they have implemented the changes to the quality measures in their platform as well. CMS also removed 11 quality measures for MIPS 2021, 8 of those being claims-based quality measures. So we have a list of those measures in Appendix A further through the slide deck if you want to look at the specific measures that have been removed. For the cost performance category, there was update to existing measure specifications to include telehealth services that are directly applicable to existing episode-based cost measures and the total per capita cost. There were no changes to the 18 episode-based measures or the Medicare spend per beneficiary clinician. And remember that clinician was added in 2020 to the end of that measure set. The weight of the cost performance category was increased to 20%, like I just said, for 2020. And then the weight for the cost performance category for APM entities reporting the traditional MIPS is going to be 0%. There were not many changes to the improvement activities for 2021. 2 improvement activities have been modified and 1 was considered obsolete and it was removed. The COVID-19 clinical data reporting improvement activity was modified but remains available for payment year 2021. Established policies and processes relating to nominating new improvement activities were also set forth. And then for further look at the improvement activities for 2021, please look at the 2021 improvement activity inventory resource provided for you in the chat. It's also linked here on the slide. All right, for the 2021, in promoting operability, the query for PDMP as an optional / bonus measure was upped to 10 points and retained. There was a slight name change. So for the old support electronic referral loops by receiving and incorporating health information has now been changed to support electronic referral loops by receiving and reconciling health information. An optional health information exchange bidirectional exchange measure was added as an alternative to electronic referral loops measures. This measure is worth 40 points and seems like a great option to replace the two 20-point measures, but there are factors to consider. First, does your state have an HIE? Can you sign up for the HIE? What is the cost to join the HIE? It is a good idea to contact your local HIE and get these answered before you officially decide that this is the measure you want to pursue for your 90-day PI reporting period. And now I'm going to hand this over to Sharon Phelps, who will be presenting the Mips Value Pathways.
Okay, Miranda, I need to do a quick sound check. Can you hear me okay?
Yes, I can. Okay,
great. Before I jump into the topic of Mips Value Pathways, I'd like to get a sense of how familiar our audience is with them. So London, can you quick pop up the next poll? Your choices in this poll is yes, you know at least something about MVPs, or yes, you've heard of them, but don't know a lot, or nope, MVP used in this context is a brand new term to me and I know nothing. So I'm looking forward to seeing what your responses are. And Lyndon, when you think we've given everybody enough time to answer that poll, I'll let you go ahead and pop up the results. Okay, looks like not very many people know anything about them. So good, I'm glad to know that. Hopefully when this is done, you'll know a little bit more. Okay, let's start with the basics on MVPs. Mips Value Pathways, otherwise referred to as MVPs, were first introduced in the 2019 final rule with an anticipated start date of the Mips performance year 2021. In other words, where we are right now is when they were scheduled to start. However, CMS has pushed that back a year due to the impact of the pandemic, the public health emergency and COVID, because that kind of threw a wrench into everything for everybody. So we are not going to have MVPs available for people to use until performance year 2022, a year from now. What they did do in the 2021 final rule is CMS came out with some guiding principles for development and review of the MVPs. So it wasn't that they ignored it completely, they just did some more background work on it. At a very high level, MVPs will be a set of cost, quality, and improvement activity measures and activities. You can think of it as a bundle, because everybody's kind of used to that term bundle. These sets may be focused towards a specific medical specialty, or they may be focused on a specific disease state, such as hypertension or diabetes. When you select an MVP, you won't have to figure out which quality measures you're going to use or which improvement activities, as those will be predetermined for that specific value pathway. This bundling reduces the burden of you having to figure out which measures and activities you are going to do, because it's all part of the bundle. Another thing, by using an MVP, you may be able to compare your performance to other people that are using exactly that same MVP. MVPs, as I mentioned just a bit earlier, will be coming out in the proposed and final rule for 2022. So CMS has a process in place where selected entities, actually anybody who is interested, can submit those. So people who may be submitting an MVP for consideration would be people like professional organizations, specialty societies, academic institutions, or researchers, or other stakeholders. We may even see like large clinics that do a certain specific set of diagnoses and follow certain quality measures. They may want to design their own MVP and submit that for consideration, because that really encompasses what they are doing. That submission process is underway, and CMS will be selecting which MVPs go in the proposed rule to get feedback, and then they'll come out in the final rule. We will also see more MVPs as time goes on. Just like there's a process to create new improvement activities and new quality measures, this MVP process will also be an ongoing thing. Not surprisingly, MVPs are meant to be a step into alternative payment models, because that's really where CMS is kind of wanting everybody to go, is towards APMs. So there's going to be similarities between APMs and MVPs where possible. So that brings us to our next topic, which is the Apm Performance Pathways. So the Apm Performance Pathway, referred to as APP, is a new reporting framework that starts right now in 2021. The APP replaces the Mips Apm scoring standard and is built to align with the MVP framework. Additionally, APP gives providers a broader set of submission methods than what was available to them under Mips Apm in previous years. So in previous years, those folks that were in a Mips Apm, they were required to participate in Mips through their Apm entity for scoring for the quality measures under the Mips scoring standard. Starting in 2021, those participating in a Mips Apm can now submit their data as an individual, at the group level, or at the Apm entity level. So the Apm entity can still report on quality and improvement categories, or that can be done at the individual level. Lest I create any confusion here, I want to make sure that you understand only eligible clinicians who are in a Mips Apm or who are in an advanced Apm, but they don't meet the qualified participant thresholds for payment amounts and patient count. Only those two groups can be part of APP. So if that sounds interesting to you, how that's set up, that's kind of what MVP is going to do for everybody who's in traditional Mips. Okay, the next thing we're going to talk about is we're going to talk about kind of how what's included in APP, because we know APP is available right now, so CMS has it defined. So what it's doing is it's giving you a little bit of a glimpse at what an MVP may look like in the future. So the APP, like the MVP, is composed of a fixed set of measures for each performance category. Unlike MVPs, however, CMS has defined these measures for 2021. So a few specifics. The cost performance category will be weighted at 0, as all Mips Apm participants are already responsible for cost containment under their respective APMs. So there's nothing in the cost category for APP. The improvement activity category is weighted at 20%, and you will automatically get scored 100% in the improvement activity category if you are participating with a Mips APM because of the activities that you are doing as being part of that APM. The promoting interoperability category performance is weighted at 30%, and it will be scored at the individual or group level and will need to be reported at that individual or group level. That's the same as it works right now. So there's really no change in Mips APM for the PI category. Where the biggest change is the quality category. So the quality category will have a 50% weight, just like it does now. But unlike right now, APP only has 6 quality measures as opposed to the 10 that we see in CMS web interface right now. So those 6 quality measures are measure 321, which is CAPS for Mips, the CAPS for Mips survey. That is administered by an outside vendor and reported by that vendor to CMS. And I think typically the CAPS for Mips vendors may be selected at the APM level. So, but that CAPS for Mips is the patient experience information. All of that's rolled into one measure, so you get a score for that measure. The next 2 measures are calculated from administrative claims. So there's nothing you need to report. CMS will calculate those from what comes in on claims. Those 2 measures are measure 479, which is the hospital-wide 30-day all-cause unplanned readmission rate for Mips eligible clinician groups. Huge long name. So, but that one's calculated automatically and you'll get that score when you get your Mips score. Measure 480 is the risk standardized all-cause unplanned admissions for multiple chronic conditions for ACOs. So that measure is just looking at ACOs, not everybody. So that leaves only 3 measures that you need to submit data for the APP. Those 3 measures are measure 001, diabetes, hemoglobin A1C, poor control. Measure 134, preventative care and screening for depression and follow-up plan. And measure 236, controlling high blood pressure. You'll notice that 2 of those are outcomes measures. So it's a much smaller group of measures that you have to work on, but they're really high value measures because they have that outcome component, which really gives a better look at the results of the work that you're doing. For those Mips APMs that aren't quite ready to have their participants report using their EHR or using some other method, for performance year 2021 that we're in right now only, you can still use the CMS web interface this year. But past this year, CMS web interface will go away. So if you choose to do that CMS web interface instead of APP this year, you will still do the 10 measures that are part of the CMS web interface. So if you think about it, if you have the capability to do APP, you'll be doing 3 measures. If you do CMS web interface, you'll be doing 10 measures. Okay, the last point that I want to make on this is that the quality data submitted for Mips with APM is also going to satisfy the reporting requirements for the Medicare Shared Savings ACO. So instead of having to do 1 set of measures for the ACO to report and 1 set for Mips, you're now just going to do one set. So that's one of the ways that CMS is really looking to reduce burden, to reduce the amount of stuff that the clinics have to do to make it easier for you to focus and to actually drive towards improvement instead of just reporting. So With that, I am going to turn it over to London, and she's going to go through the rest of the slides for us. Thank you.
Thank you, Sharon. Are you able to hear me okay?
I can hear you just fine.
Okay, wonderful. All right, so why don't we go to the next slide, please? We are going to discuss, CMS gave an extension to the extreme and uncontrollable circumstance hardship application. So you have until February 1st. And if you or your clinic has experienced any problems due to COVID-19, you can apply to be relieved from all 4 categories of your Mips reporting requirements. You can also choose just one of the 4 if you want, but just wanted to let you know you have until February 1st if you need relief from your Mips reporting. You can always check at qpp.cms.gov. That is the same place that you would go for those hardship exception applications. That's where you would also go for your Mips updates or any new topics that are out. Really, that website is a wealth of information. At the bottom of that page, you can sign up for their listserv so that you can get emailed about all of the CMS webinars that are out. As of right now, we are not aware of any flexibilities for COVID-19 for 2021. It's possible that CMS will come out with a rule later to tell us about that, but so far we have heard nothing. So we'll go to the next slide, please. So these are going to be some 2021 considerations for us, and we'll head into that next slide. So for 2021, first step is check your eligibility. One thing I want to highlight here is when you're checking your eligibility, there's something to note that there are 2 determination periods. So in December of 2020, we got this initial eligibility for 2021, and that covered your claims data from October 1st, 2019 to September 30th, 2020. So in that QPP portal, you should be able to see your eligibility for 2021 based off of that time frame. If you don't see any eligibility for yourself or a clinician that you're looking up, it is still possible for them to become a Mips eligible clinician during segment 2. Run 2 of Mips eligibility determination covers from October 1st, 2020 through September 30th, 2021. Now that information doesn't come out until November of 2021. It doesn't happen to a lot of people, but it can happen. So I just want to put it in your mind to double check eligibility towards the end of the year. Now, if you looked in the lookup tool and it says that you are not a Mips eligible clinician for run 1 of 2021, you don't have to worry about falling into this category of people. This is really for clinicians whose eligibility wasn't determined during run 1 that could possibly or potentially become Mips eligible during run 2. So, once again, you can look that up on that same website, and that your Mips eligibility is really determined at the 10 NPI level. So if you're a clinician billing at a 10, you could be Mips eligible there. If you're billing at another 10, you could be not Mips eligible there. So really, it'll give you the information for every one of those combinations. Another thing for you to think about as we're looking at 2021 is your 6 quality measures. Miranda alluded to the fact that there were some changes that were made to quality measures. We heard that there were 11 that were removed, but there were over 100 specifications that were updated. Currently, that qpp.cms.gov website does have a measure lookup tool, but that's not updated yet for 2021. But you can go to the resource library on that same page, and that would be under the resources tab. Go to resource library. There you can look up the measures specifications for 2021. You can look up your quality measure specifications and read all the details there. You can also look up your promoting interoperability and improvement activity measure specifications. Those would also be in that resource library for you currently. And remember that your PI and your IA are a 90-day period. So quality measures are looking at the whole year of 2021. And then for those other 2 categories, it's just that 90-day period that you're really focusing on. Next slide, please. All right, so a couple other things that might need your attention. Do you qualify for facility-based quality and cost scoring? One of the ways you can look that up is in that same lookup tool I was just mentioning. Under your special status, it'll let you know if you've got that facility-based. You can work with your hospital to see if you can be scored on their hospital value-based scores. Another good thing for you to just think about, or maybe even check with your vendor about, is when will your measures be updated in your EHR or registry? Even though those measures are available right now, that doesn't mean that they've necessarily been updated in your system. So it's a great thing to check with your vendor to see, are those updated measure specifications currently running, so that you know that you're collecting the most accurate data. Another change for this year, because of the 21st Century Cures Act, you'll want to check with your EHR vendor to see if there have been any changes or updates due to that Cures Act. I know that there have been a couple of EHR updates that are recommended for that, and so just check in with them. And then another thing, when Sharon was talking about the MVPs, it's a really good idea to check in with your specialty or professional associations. Are they going to be soliciting any input for the MVP design? You know that you want those to work for you, and CMS needs your feedback if they're going to make that happen. So, next slide, please. Just wanted to reiterate that it's going to be a lot harder to get to that neutral threshold this year. The minimum reporting is 60 points. That's up from 45 points from this last year. So we know you're going to need to report your full improvement activities. And for small practices, that is either 1 high-weighted or 2 medium-weighted improvement activities. If you're not scoring well and you're promoting interoperability, file for that hardship exception. As a small practice, you would be approved for a hardship exception, which would then reweight those points to quality. Of course, if you're scoring well in your PI and you can report, definitely do. Just wanted you to know that that is an option. If you're looking and you don't have a good score, you can reweight that. Also, your quality. You're going to have to do better than just the minimum for your 6 quality measures this year in order to meet that neutral threshold. And then you're also going to want to confirm that you're accurately coding to ensure that your patient complexity is accounted for, and that your complex patient bonus and cost measures are accounted for. You can review last year's cost scores and look at your different cost measures that you earned points on. Next slide, please. So CMS also introduced some changes to third-party vendors, right? So your EHRs, your qualified registries, your HIT vendors, their goal was to reduce reporting burden for clinicians. They wanted to allow those third-party intermediaries to be able to support the MVP and APP submission. They also established some specific data validation requirements, and they're asking, to get that data accuracy, and they're asking them to conduct targeted audits if errors are identified. Their plan for that is to be able to hold those vendors accountable for performance and accuracy within their system. There's also been some updated measure standards. Those are just some things to consider for 2021. Let's go on to the next slide as well. Well, that was the end of my slides. So I got through those a little faster than I had anticipated. It looks like we had several questions that came in chat, and I haven't quite had a chance to dive through those. Erin, I know you were monitoring chat. Do you have any questions you want to bring forward for us? Are you able to, let's see.
You might have to unmute the participants.
Yep, I unmuted Erin.
There we go.
Erin, are you able to? Yep.
So I have a couple. I'll just go through chat real quick. Full disclosure, I don't know if I was able to see all of the questions that were entered, especially if they were just sent to the panelists. And so if one of the panelists can look, if I miss any, just please feel free to put those in. And so this is from Mark. It says, so eventually we will have to move to an APM format. Is Mips going away?
Yeah, I had seen that question. I think I answered that one in chat. Sharon, do you want to
I sure
allude to that
can.
one as well? Mm-hmm.
We see nothing from CMS about them officially sunsetting and getting rid of Mips. And I've never heard anything from them on that. What we do hear is we hear a lot of language from them that they want people to move into value-based programs like alternative payment models. And the CMMI, which is kind of the innovation engine at CMS, comes up with different APMs all the time. State level Medicaid agencies are coming up with APMs. Commercial insurances are coming up with APMs. So APM is just this big umbrella term. And CMS really wants to move people into that sort of arrangement to help improve quality and help get a handle on cost. So there is nothing being said that Mips is going away, but they are truly trying to incentivize people to move towards APMs, much like they incentivized people to move towards using electronic health records.
Thank you, Sharon. We also have another question. Are APPs optional for 2021? I think we missed that.
Yeah, I threw that one out there in the chat. For 2021 only, Mips APMs have the opportunity to select using APP or what they've currently been doing with the CMS web interface to report their quality measures. They get a choice in 2021. In 2022, APP is the only option, but Mips APMs must report either way in 2021. So I hope that clears that up.
Thank you, Sharon.
Yep.
We also have a question here from Dr. Oh, go ahead, Erin. Were you going to say something?
Oh, I was just going to go for the next question, but.
Please go ahead.
It says, is there an easy to follow instruction set for Mips to APM transition pathway?
I think that answer is no. That would be my answer, because each APM has its own structure and its own setup. You really need to talk more with an APM to find out what you need to do to get involved with their APM. That's not something I would feel comfortable saying, okay, you follow these 5 easy steps and poof, you're there, because it really depends on the structure of that APM. What I can tell you is start looking at outcomes measures, because I know the APMs focus a lot on outcomes measures. Look at your patient experience scores. If you currently do something like CAPS for Mips or other patient experience scores. And most importantly, get a quality improvement process set up in your clinic where you're identifying opportunities for improvement. You're setting up small cycle changes to make improvements, see how those improvements are working, and based on that, make additional improvements to move towards a larger goal. And if you start to do that and think along those lines, those things really help get you set up to be ready to get started with an APM. London, I think you've worked with a number of APMs. You may have additional suggestions on that one.
I think those were good suggestions. I have another question here. Delana Button, we participate with an ACO, but have been notified that we have a handful of providers that are now preferred versus full participants. This puts them as required to submit for Mips this calendar year. Would those providers follow the MVP pathway? Well, MVP pathway isn't available yet for 2021. Remember, they won't be coming out till 2022.
Let me look at that one. We have.
I think that they would also need to check with their ACO and find out exactly what they mean as preferred. So, I mean, the ACO could potentially be classifying them as preferred, meaning that they want them to participate in the promoting and operability category, and the non-preferred can do the option to not to. But again, with your ACO creating these identifications or identifiers for certain clinics, you would definitely need to reach out to them to find out what their theory is behind that and how they plan to move that going forward. Like, what do the preferred participants have to do?
Mhm. And then we have another question. Can we cover if we will still see a positive payment adjustment if we apply and are confirmed to reweight one category due to COVID-19?
It's all going to
Yes.
boil down to your score. So if you reweight a single category, the weight of that category typically gets put into the quality category. So let's say you reweight promoting interoperability. So now that gets put in the quality category. So now your quality category has a higher weight. And depending on what your score is, if you're above that neutral benchmark, then you are in line for a positive payment adjustment. If you're below the neutral benchmark, you're in line for a negative adjustment. So it's all based on the score.
Mm-hmm.
It is
So I have
important to
another
note as
question.
well that sorry, I was just going to say it is
No,
important
go
to note
ahead.
as well that with COVID from 2019 and 2020, the payment bucket, because it is a budget neutral program, for the payments out has severely decreased because people have taken the EUC option for 2020, and in 2019 there's people that if they didn't report, they weren't assessed the negative adjustment, so that money did not go into the bucket for the payouts. So you'd have to get a really high score to get the exceptional payout, and the exceptional payouts for the year of 2019, so in 2021 and 2020, which will be in 2022, are going to be a lot lower than they have in previous years due to the fact that there has been options for providers not to get the negative benchmark, so they are not, or the negative adjustment, so they're not punished because of COVID related issues.
That brings up a question out there. Is there any penalty for filing for the hardship in 2020? And no, there is no penalty that we know of.
That's right. I see a good question from Mark. He says, does it matter what month of 90 days you report? It doesn't matter the month, but it needs to be 90 consecutive days. So it has to be those 3 months in a row, and it can be the first 3 months. You know, you can really pick and choose what 90 days you want to report on, but it does need to be consecutive.
And it doesn't need to be like the first day of the month. So it doesn't need to be like January 1st. I mean, you could start on January 17th or 18th or whatever it is, just as long as it's 90 days. And the only time period that you really need to be careful on is starting in October, because that puts you right up to the end of the year. So be careful if you plan on reporting the last 90 days of the year that you don't end up having 89 days or, you know, fewer than 90.
Mm-hmm.
Okay, we have
another question that came in, Karen, and I see a couple of people identified with it. Is there an easy to follow instruction set for Mips to Apm transition pathway?
I think that's the one that are you thinking like the Mips Apm to APP, or are you talking traditional Mips to Apm? I think we answered that one a little bit earlier.
Gotcha.
I do see one from Vanessa. How does Mips reporting work for Locums providers? Do all places they've worked have to submit? Is the provider expected to coordinate reporting across the organizations they've worked at? So that's a great question. CMS looks at the 10 NPI combination. So each place that Locums provider works and they bill with that Locums NPI, they're going to get a 10 NPI combination. And CMS evaluates the volumes for number of patients, number of dollars, and number of services that Miranda talked about earlier. They evaluate that at each one of those combinations. So we have seen providers that have 9 different places where CMS has evaluated, have they met those volume statuses? So the provider only has to report when they meet those volume standards at a given location. So if they work at 30 different locations and they never meet the volume standards anywhere, then there's no penalty for not reporting. But if they only work at 3 or 4 places and they meet the volume at each one of those, they have to report for each one of those. Typically how that's done is the place where they work will do group reporting, and that automatically pulls the locums in there. But if those places report individually, the provider needs to check with that facility to make sure that their data is going to be reported for them along with the other individual providers. So the locums provider does not have to try and combine everything from all these places into one bucket, but they do need to make sure that each location is reporting if they have exceeded the volume standards for that location.
Yeah. I see another question that's a couple of times. It looks like there is a doctor who's a hospitalist. In 2020, he could only report 2 quality measures by claims and 2 medium improvement activities to avoid the negative adjustments. After reviewing the 2021 quality measure and improvement activities resources, he can still only report the same 2 quality measures and 2 medium improvement activities. Will this be enough to avoid the negative adjustment in 2023?
Since this provider is a hospitalist and is associated and working at a hospital, I encourage you to go look at their eligibility data and see if they qualify for being facility-based and which facility they're connected with. And you can see that when you look at the eligibility data. When you are a facility-based provider, you can take credit for Mips for the hospital's quality reporting that the hospital has to do. So you will get a score based on the hospital quality, and you'll also get a cost score based on the hospital quality under what's called the hospital value-based program. So I would encourage you to...
He's not working for a hospital. So let's see.
No.
Maybe we could, Lisa, maybe we
now
could
he doesn't have to be an employee of the hospital to be facility-based. How facility-based is determined is by the location of the patients you treat. So they look at the volume of your patients that are treated in the ER as an inpatient or as an outpatient in a hospital setting. So there's a difference between being employed by the hospital and being facility-based because you are providing services to hospitalized patients. Does that help answer that? I don't know that we've seen that back. Okay, if there's a continued question, do we have other questions, London? Oh, you are on mute, London.
Sorry about that. There are other questions. Since we have an option in 2021 for reporting APP, and they are only available by summer, how will we know if we are on track prior to meeting the 3 qualities in them? Also, do you know how many different bundles will there be to choose from?
We have no idea how many bundles will be approved next year. CMS, I don't think is going to be releasing information on how many bundles are under consideration and who's doing them until the proposed rule comes out. And that's because this is part of what they call the rulemaking process. And whenever something is subjected to the rulemaking process, they are very cautious about when and where they let information out because they don't want to create an unfair advantage or disadvantage for anybody. So they keep pretty mum on those things. As far as the 3 quality measures, that's under the Apm Performance Pathway, which is only available to those folks in Mips APMs. So hopefully whatever Mips APM you're part of is working with you to help you learn how to monitor the status of those quality measures within your electronic EHR or if they have some other reporting mechanism. So I would go to your APM and ask that question.
She did follow up that she worries about the 3 measures that were given during the presentation. As a podiatry clinic, they don't have any control over a patient's A1C, or if, you know, if the patient reports bad A1C levels, does that lower the quality measure? Same thing for high blood pressure.
You know, how we've recommended to people in the past to handle those things, that a podiatrist is now getting credit, good or bad, for something like diabetes control. And they're not the ones who are adjusting the medication levels and doing any of that. That's where we recommend really close coordination and communication between the providers. So if the podiatrist is noticing issues with the patient and they know the patient is a diabetic, what sort of contact do they have with the primary care physician? Are they working together to reinforce that measure of control? And the podiatrist may be seeing things that he needs to bring to the attention of the primary care physician. So even though the podiatrist is not the main person in charge of keeping, you know, monitoring and dealing with the diabetes, they do have interaction with the patient. They can reinforce the messaging. They can report signs and symptoms of poor control, poor compliance. So I realize there's not a direct thing there, but you know, within the context of the APM, that's what they're looking at now, is driving that team-based focus towards strong outcomes.
Yeah. So here's another one. Last year, we were told that physician assistants would have PI reweighted to quality. Is that true for 2021 as well?
Yes, there's no change to that. So there's a specific list of clinician types that are automatically, that have their PA automatically weighted to the quality measures. So that has not changed, but it is important to remember that that only works if, number one, that physician assistant supplies their data as an individual. If they report as a group and the rest of the group does not have that automatic reweighting assigned to them, then that physician assistant will be required to report PI data. If the rest of the group, yeah, actually that's about it. So that's the one way to look at it. The clinician types that have automatically been reweighted will still be automatically reweighted in 2021, and they will lose that exemption if they report as a group and the rest of the group does not fall under that category as well.
Thank you. And then here's another one. How do you confirm you are getting the right adjustment from 2019? Do you see the adjustment listed on your claims?
That's a great question. So what you want to do, and London, we may need to do a follow-up because I don't know that I'm going to be able to get to the document before we're done here today. But where you're going to find that information is on your remittance advices from Medicare. So if you look at a remittance advice that comes in from Medicare, there are a number of different codes on there for different purposes. And there's a wide variety of codes. And there's a specific set of codes that will tell you if you are getting an adjustment for Mips. And so we'll try to get that document. It will be located in the qpp.cms.gov resource library, and we'll get the link for you to be able to look at that. And so it's the remittance advices is where you'll get that question answered.
Thank you. I have another clarifying question. Eventually, will everyone have to be MVPs, or can they continue to just do regular Mips? This is coming from an optometrist's office.
Yeah. At this point in time, we see nothing saying traditional Mips is going away. CMS is putting MVPs out there as really a mechanism to try to reduce burden and streamline, as well as group things together to be able to maybe compare apples to apples to determine what are we doing to get strong outcomes versus where we're not getting strong outcomes to really help drive value and derive quality. Now, for optometry, I would be very surprised if we do not eventually have a bundle from optometry. Optometry has been very good about building a number of their own measures. A lot of them have their own EHR and they build their quality measures right into that EHR. And they seem to have a pretty good process in place. So you might want to check with your optometry association and see if they're planning on building an MVP for optometry, because they've done a lot of work in that space.
There's a question here about the 5% APM payment adjustments. Are they part of the Mips program? I think I can answer that. They're their own separate. It's a separate pool of money.
That is correct. Yep.
And it's a lump sum payment. It is not a per service payment like we see with Mips.
Okay, so it looks
And
like we're coming
Charlotte,
to the end of the questions.
Mm-hmm.
Was there anybody else that wanted to get a last minute question in there? You can go ahead and come off mute and just ask it live if you would like.
I do think we had a follow-up question for the one on the hospitalist. So this physician is a physical medicine and rehabilitation provider. And I don't think the specialty makes any difference at all to facility-based. How facility-based is determined is the services, the location of the patient for the services that were provided. And where you go to see if your physician is facility-based is you go look at the eligibility either on the qpp.cms.gov website or you look in the QPP portal. And as far as figuring out what are those scores for the hospital from the hospital value-based program and how does that convert to a Mips score for a provider, if you go into your QPP portal and you are facility-based, they will have information in there that you can look at to see how they determined your score. And I think one of us put something in the chat box for that person to reach out to their state level account manager to walk through that in a little more detail than we have time for today.
Looks like they're actually in Arizona, or I'm sorry, Nevada. So
Okay.
They're lucky because I believe Aaron would be their point of contact.
Yep. And Aaron's on the call today.
Yeah, so when we get the registration from the webinar, your email will be attached and he'll make sure that he reaches out to you, or one of us will. So we'll definitely be in contact to get more of these finite questions that you have taken care of. But it looks like we are coming up on time right now. So we just have a few more things to go over before we close out the webinar. Sorry, here we go. All right, so we would ask that after, that's about all the time we have for today. So please fill out our evaluation survey. We want to know your thoughts on today's webinar and get your feedback on topics of interest for future webinars. This is the Appendix A that we were talking about earlier with the removed measures. And these are the claims-based measures. Here's the Appendix A with the removed quality measures for the CQM measures. You'll see that some of them overlap. And finally, here's the Appendix B, which we go over the MSSP ACO information. So finally, here are the contacts for Comagine Health and Mountain Pacific by state. So we just want to say again, thank you for participating in the Mips Tips webinar. If you have any questions, please feel free to reach out to the staff in your state. These are the contacts for QPP experts for both the Comagine Health and Mountain Pacific states. So I'm going to go ahead and leave this up here for a second, but that will basically be it for today's webinar. Thank you for joining us.
Thank you, everybody.
Thank you all.